Today, the CDCA works in 5 main areas: healthcare, sustainable agriculture, sustainable economic development, appropriate technology, and education. During the first 5 years in Nicaragua, the CDCA had hosted medical brigades, but after Hurricane Mitch, Nueva Vida asked the CDCA to work together to improve the community's access to healthcare through a clinic. The CDCA opened its permanent clinic, including a people's pharmacy, in 2001. The clinic was built with volunteers and Nueva Vida residents together. As time progressed, the CDCA surveyed the community to see what was needed, always listening, always in coordination together with the local communities. As a result of those conversations, the CDCA expanded clinic services in 2002 to include family counseling services, followed by a lab in 2003, a dental clinic in 2007, and more widespread chronic care service in 2008. Today, a general practitioner sees patients, and after lab tests and diagnosis, medicines are given out from the People's Pharmacy. The clinic holds files on close to 14,000 patients, but the work is still done together with the community. Those coming to see a doctor are asked to collaborate with their healthcare in some way. They can pay a symbolic fee to receive a visit with the doctor and the medicine prescribed, or they can earn bonos.
A bono is just a coupon that certifies that people have done 4 hours of volunteer work for the well-being of the community, for community cleanup efforts, for people that volunteer at either the public schools or at the Ministry of Health outposts.
In 2007, the Nicaraguan government declared healthcare free in Nicaragua, which has meant improved public services. In order to better meet the needs of its clinic patients in this changing reality, the CDCA is constantly in conversation with the local community.
We had a position open, and instead of just automatically hiring another general doctor, we decided to find out what the community wanted, and so we sent health promoters door to door, working as hard as we could to reach every single family in Nueva Vida.
Healthcare is a right, but for healthcare to succeed, it needs to be developed in coordination with those served. One of the CDCA's first projects was in sustainable agriculture, with the planting of organic sesame beginning in 1995.
We were working with a whole lot of small rural communities by and large. A lot of our economic efforts were on agricultural development.
Hay productores de muy bajo nivel de escolaridad, pero tienen mucha experiencia en el campo y han trabajado mucho tiempo en el campo, saben las características de su suelo, saben trabajar su tierra, que han aprendido de sus padres, de sus abuelos, y ahí también he aprendido yo mucho de esos productores.
The CDCA began helping farmers by working together and learning from one another. Over the years, this work has expanded from the 17 original growers to include well over 2,000 growers who produce organic sesame, honey, peanuts, cashews, coffee, and cotton. Growers are paid up front for their crop, and because small farmers are working together, they do not have to be big producers to access a better market. The CDCA helps farmers to market their organic crops for fair prices. Renee's cooperative was unable to sell its organic coffee because of the co-op's small production, until the CDCA began working with the community of El Porvenir 8 years ago.
La parte más donde hemos logrado establecer una economía más o menos sostenible, pues ya no estamos manejando una pobreza, sino tenemos una pobreza media.
The CDCA has now expanded its sustainable agriculture program to include working with organic cotton farmers. Although Nicaragua used to be the largest producer of cotton in Central America, monoculture practices stripped the land, and when the bottom fell out of the cotton market in the late 1980s, cotton production ceased in Nicaragua. In 2007, growers working together with the CDCA produced 180,000 pounds of raw organic cotton. And in 2008, the CDCA set up a cotton gin to process that cotton for market. All part of an effort to create a production chain uniting cooperatives in Nicaragua producing organic cotton, ginning cotton, spinning cotton into yarn, knitting cotton into cloth, and sewing organic garments. The CDCA is now focusing on this sustainable production chain in its work with sustainable economic development, the largest and fastest growing aspect of the CDCA's work. For years, the organization has provided micro-enterprise loans to individuals, including loans to many artisans, like musicians Marta and Luis of Guitarra de Madera Azul, to produce their CD and make jewelry. After 15 years' experience in microenterprise, the CDCA has concluded that while these small loans are essential, they are insufficient. A microenterprise loan can help a family improve its situation within the scope of poverty, but they remain poor. In the face of such vast unemployment in a country where nearly half the population lives on less than $1 a day, to really lift themselves out of poverty, the poor need a more serious investment under a different model. To that end, the CDCA now partners with cooperatives, helping Nicaraguans set up worker-owned